Jonathan Kopelovich. I'm an otolaryngologist, which means I specialize in diseases or problems that are in the ears, nose, or throat. And I have special training or fellowship training in pediatric otolaryngology, which means that I help take care of some of our youngest and sickest patients. I was born in New York, and I did my training all over the country. Grew up in Florida, did my undergraduate degree in Philadelphia at the University of Pennsylvania, stayed in Philadelphia for medical school at Jefferson Medical College, and then went to the University of Iowa for 7 years, where I did ENT residency and 2 years of research in neuroscience and cochlear implants. After that, I did a pediatric fellowship at the Children's Hospital of Colorado in Denver. And from there I came here, where I settled with my wife and now 3 kids. I have 2 boys and 1 4-year-old girl. We love it out here. Our family is here, and we feel great being in the Pacific Northwest. My practice encompasses all of the kids of King County and even beyond. And then I do see some adults as well. And so my schedule tends to get filled. And so what I try to do is create capacity by having slots for same-day appointments or more acute issues, so parents can also get in when they have that pressing need. I also now, after changes associated with the coronavirus epidemic, have telemedicine slots every day, because what I found is that it's a convenient way to connect with parents when there's a discussion that needs to be had and decisions that need to be made, but that don't require a physical exam in person. My parents seem to appreciate it, and I really like the convenience for families. One of my very favorite things to do is to place cochlear implants in kids with hearing loss. Kids do wonderfully with these devices in terms of having access to sound and access to spoken language. It's amazing what they're capable of. And another area where I feel like I can have a strong impact is in speech surgery. You know, often kids who have a history of cleft palate, either repaired or unrepaired, will have difficulty with speech articulation. So I find that quite rewarding, because just a small thing that I can do can have a huge impact on a child's life. We try to have fun. We are primarily kids here, and grown-up kids. And so we do a lot of playing in the clinic room, and I try to make sure the kids are at ease, talk to them about whatever they're interested in, and then try to get to the heart of the discussion pretty quickly with parents. Once we have a little bit of rapport, I then try to be gentle in everything that I'm doing and make sure that there's as little fear involved as possible, so that we can look in small little ears and noses and the back of throats, and sometimes even do small flexible scopes in clinic or small procedures. And generally speaking, as long as we've had some time to develop a bond, things go really well. And the nice thing is, after any uncomfortable experience, when kids are feeling better, they tend to come back smiling. So I think the days of being the sole captain and the person who runs the show are gone, and really we live in a much more collaborative time. So there's shared decision making with parents, there's shared decision making with patients, and I tend to collaborate with a lot of other providers very closely. In the pediatric world, a lot of care ends up being multidisciplinary. So daily I'm on the phone with pulmonology, GI, speech therapists, audiologists, and we collaborate quite a bit to come up with a combined care plan, so that we can deal with complex issues in a way that's digestible and convenient for parents and families. I have been known to rap poorly on occasion. Sometimes my parents ask for me to do that, and I will, though I think my skills in that regard are diminishing as my skills as a surgeon are increasing. So be prepared for some bad hip hop if you come to my clinic.